Hello, and welcome to TEDCO's presentation of the 100th University Technology Development Fund Award. 2010 has been a year of change and milestones for the Maryland Technology Development Corporation. We honored our 200th funded company through the Maryland Technology Transfer and Commercialization Fund. I was recently appointed president of TEDCO, and the reason we're here today is for the first TEDCO live stream and the celebration of our 100th University Technology Development Fund Award. TEDCO's University Technology Development Fund helps university researchers develop and assess viability of new technologies, test prototypes, and optimize principal research designs. Dr. Linda Saffer should be commended as program manager for TEDCO's University Award program and should be commended for all of her work with this program and is an integral member of the TEDCO staff. Dr. Saffer, thank you and congratulations for your hard work. Critical to the success of this work with the universities are our relationships with the various university technology transfer offices. Today is not only a great day for TEDCO, but for the Johns Hopkins University School of Medicine. Special thanks to Aditya Polsani, Industrial Liaison for Biomedical Engineering and Brain Institute, and Wes Blakeslee, the Executive Director of the Johns Hopkins University Tech Transfer Office, who will join me now to say a few words.
Thank you, Rob, and thank you to TEDCO. We really appreciate all of the programs that the state of Maryland has that support our industry. In particular, the TEDCO grants, such as the UTDF, are so important to the commercialization of early-stage university technology. Over the years, many companies that have been created based on Hopkins technologies have received TEDCO funding that has been critical to the advancement of those companies and the technologies. So thank you.
Thank you, Wes. Today we would like to recognize Dr. Tandri and his team of recipients of the 100th TEDCO UTDF Award. Dr. Tandri and his team have designed the Rapid Hypothermia Induction Device to chill blood entering the brain during cardiac arrest, ultimately improving neurological outcomes for patients post-cardiac arrest. This technology is poised for great success. Prior to its invention, there was up to a 6-hour delay when administering hypothermia to cardiac patients. Dr. Tandri, thank you and congratulations.
Thank you, Rob. Thank you.
If you could say a few words about your technology, we would appreciate it.
Sure. Thank you, Rob, and thank you, TEDCO. Cardiac arrest is a leading cause of death in the developing countries. It accounts for over 400,000 deaths annually in the United States alone. Only 7 to 10% of patients who have cardiac arrest survive, and even among them, over 50% are left with permanent brain damage. The only treatment that has shown promise in cardiac arrest situation is hypothermia. Hypothermia is defined as a reduction of body temperature by more than 2 degrees. Actually, the definition of therapeutic hypothermia is lowering the body temperature to less than 34 degrees. American Heart Association recommends institution of hypothermia as early as possible in a cardiac arrest situation. However, this is not easy, as there is no easy way to deploy a hypothermia device in an out-of-hospital setting. As such, there's an enormous clinical need for a device that can safely induce hypothermia in a cardiac arrest situation. Using the nasal heat exchange mechanism, we at Johns Hopkins have devised a device which cools the body using the body's own innate heat loss mechanisms. The device uses a high flow of optimized air delivered through the nostrils to induce hypothermia. Slide 1. Shown here is a conceptual design of the device. On the right side is shown, on the left side is shown the design of the device attached to a pair of nasal prongs that enter the nostrils. Slide 2. Here is the device in place inside the nostril of a patient. The nasal cannula is specially designed to deliver high flow air through the nostrils, and it's easy to deploy in a cardiac arrest situation. Slide 3. If proven effective, we envision that there is a huge market need for such a low-cost device that can influence the life of cardiac arrest patients. We also envision that it will find its way into the over 50,000 ambulances that currently exist in the United States. If effective, this also will find its way in all forms of threatened neurologic injury or brain damage, such as traumatic brain damage, stroke, and post-neurosurgical hypothermia. Thank you.
Thank you, Dr. Tandri. I would again like to thank everybody at Johns Hopkins University, Linda and the rest of the TEDCO team, and especially Dr. Tandri and his team for this wonderful innovation. Have a great day.